nurse means that I can advocate for my patients, especially those who can't advocate for themselves.
It's about being somebody to connect and join and support people, and just to help their health and their well-being as best you can.
Nursing is putting the patient at the heart of everything we do.
It has to be a deep-rooted kindness, compassion, empathy from right deep down my heart.
I almost describe us as a bit of a philosophical guide to people, because especially in crisis services, we come to people at the most difficult point in their life. We have to be the light in a very, very dark tunnel.
It is important because whatever you do to each individual or to each patient leaves an impact on how you deal with them. So you want to make sure, or I want to make sure, that they're treated well physically as well as emotionally. Feelings are important too. So it's that difference you make to that individual that gives me pride that I have done my work well.
I think it is vital to remember that what matters to an individual is not necessarily what matters to us as healthcare professionals. One hat doesn't fit all. Everyone is an individual.
And so you pass the label of the dementia patient or the patient with a learning disability or the palliative patient or the cancer patient and see the person.
Nursing with homeless people is really important to me because they're people who are unwelcome everywhere they go. They're seen as a nuisance and an inconvenience, and I hope where I work now, I'm able to curate a space where people feel like you're pleased to see them.
I've always kind of had hoped that if there was enough people around to support one person with whatever they needed, whether that's specifically like within my profession, mental health, or adult nursing, children's nursing, physical health, that can make a world of difference, and that can change a whole person's story. That can change their whole life, that one person.
I'm really passionate about motivating my patients and getting them to self-manage their conditions. Made me feel like I can develop relationships with my patients and help them to manage their own long-term conditions and be that support for them.
But we have a lot of autonomy within nursing, which I think is quite a privilege, to be honest, to be quite creative and to see not only how we can help people work through the sort of mental health difficulties that they're having, but also supporting their friends and family.
With the pandemic, it's been incredibly challenging, and I certainly couldn't be the leader I am without my team behind me and my colleagues, my peers next to me. And when I think of when I was a junior nurse and the role models I've been fortunate enough to work with, the influence they've had on me and my style of management, it's been amazing.
It's an honour and a privilege to take care of so many amazing patients, and I hope that I've made a difference in their lives like they have done mine. Really, there's been nothing more rewarding in my life than holding the hand of a dying person or giving comfort to someone's relative. And you know, even though that these experiences are hard to take, it's some of the most humbling experiences that I've ever had in my entire life. And I can't encourage people more to go into this profession, because as difficult as it is, there's nothing that will give you more reward.
At the moment, it looks challenging because we know we need to train more people, we need to invest in staff, but I see enough every day in my job that makes me feel confident in the future.
It's about that positive challenge, isn't it? It's not always thinking, oh, it's always been done like this. So empowering ourselves as nurses to change the future, to change the systems, the practices.
I feel that nursing is going to become more political, that we can raise our voices and can be heard, but we need to work together to do that and put the patient at the centre of everything we do.
It's been such a whirlwind of emotions for nurses. I think they've kind of really, it's almost restarting again, or that uncertainty of what the future is going to look like now. COVID exists, and will we ever get back to where we were before, I guess.
There should be some flexibility for nursing to enable them to work from home or remotely, and also it benefits our patients as well, because a lot of our patients don't need to come into the surgery and don't want to come into the surgery, so having that access to a nurse is really beneficial for the patients as well.
And actually, maybe the well-being and the lifestyle of a nurse needs to be considered, and that's in every essence. So like emotionally, sort of mentally, physically, financially, because actually wanting to be a nurse is very powerful. And I think we need to sort of maximize on that a little bit and go back to actually what makes people want to do this career and work on that.
I can see community-based working is the future, and I believe that proactive approach is the key to minimising risk and helping patients in ageing well in their own homes and in later life.
I'd love there to be a day where people aren't treated any differently when it comes to healthcare, and there isn't the health inequalities gap and the things that we shout out for. I'd like to do myself out of a job where everyone's treated equally wherever they go for their healthcare.
We need to be telling people about this. We need to be a collected, unified force which supports one another. We're the biggest workforce across Europe within healthcare, within the NHS, and I think we need to be proud of that and stick together, because I think that's what will propel us forward. And people don't want to lose us, because we're there from cradle to grave. That's why we came into this profession, and that's why we want to leave it.